Good evening friends. Today our topic is basics of ECG. So ECG is the most frequently tested topic in NEET PG entrance and even in final year Viva. So let's get started. Right. Okay. Coming to the topic, ECG, it is defined as the graphical representation of the electrical activity of the heart and the conducting system. Okay. So there are three terms which may be confused. So ECG, as I told you, electrocardiogram is a graphical representation, the final output which you will get on a paper. Okay, electrocardiograph is the machine by which we will do ECG, and coming to graphy is the procedure which you are performing to get that ECG. So gram is the output, graphy is the procedure, and graph is the machine. Okay. Next, coming to the conducting system of the heart. This is slide shows the conducting system of the heart. It consists of SA node, AV node, and this is the bundle of His, right bundle branch, left bundle branch, which in turn divides into number of the Purkinje fibers, as you can see here. Okay, and there are three internodal tracks between the SA node and the AV node. They are anterior, middle, and posterior internodal tracks, right? Okay. Next, coming to the next slide, it also shows the conducting system. This is the SA node, this is the AV node, these are the three conducting internodal pathways. This is the bundle of His, this is the right bundle branch, left bundle branch, and these are the Purkinje fibers, which are the small fibers, which are the branches of the bundle branch. Okay. Next, coming to the different waves, intervals, and segments on an ECG paper. So let us come to this first wave, that is P wave. It is a positive deflection wave on the ECG paper. So why does the P wave occur? It purely denotes the atrial depolarization. Okay, so let me show you here. Okay, so the waves which are the impulses which are generated from the SA node are conducted through the atrial cells by gap junctions between the atrial cells, and it's the impulses spread to the various parts of the atrium, and this electrical depolarization of the atrium is represented as a P wave on the ECG paper, right? Okay. Next, coming to the PR segment, as you can see here, this is the P wave, and this straight line is the PR segment. So the PR segment represents the AV nodal delay. And as I already told you that from the SA node the impulses are conducted to the AV node, and before they are conducted through the Purkinje fibers and bundle of His to the ventricles, there is some AV nodal delay at the AV node. So it is represented on the graphical paper as a straight line, as I already told you. So this is the PR segment, this is the straight line. Okay. Next, coming to the QRS complex. Okay, let me show you the QRS wave. So here you can see the QRS wave. Okay, this is a long positive wave, and there are even small negative waves, Q wave and this wave. So let me explain why these waves occur. So coming to Q wave, it represents the ventricular septal depolarization. So the small negative deflection which we are seeing, this S wave, this Q wave is the ventricular septal depolarization. Okay, remember this much. Next, coming to the R wave. So it is the tallest wave. It is a tall wave on the ECG paper. So the R wave which we are seeing here, it represents the major muscle of the ventricular getting depolarized. Okay. Next coming to the S wave. S wave represents, as you can see here, is the small S wave, small negative deflection. So it is a Q wave, R wave, and a small S wave as well. So R wave. Okay. So this S wave occurs due to basal ventricular depolarization. That is the base of the ventricles. These get depolarized, and it is represented as the small negative wave on the graphical paper. Okay. Right. Next, coming to the T wave. This is the another positive wave which represents the ventricular repolarization. Okay, QRS wave is a ventricular depolarization, and this is ventricular repolarization. Okay, I will explain you what are these terms, depolarization, repolarization in meanwhile. So till then, these are the positives. Next, coming to this straight line between P wave and QRS complex, it is known as PR segment. Remember one thing, that is the S for segment and S for straight line, right? Okay. Coming to PR segment, it represents the depolarization of the AV node, as I already told you. Okay. Now coming to the P wave and PR segment is togetherly known as PR interval. So interval is nothing but it is the combination of different waves and segments. So what do you mean by PR interval? It is the P wave plus PR segment. Okay. Okay, right. So what is the duration of PR interval? It is 0.12 to 0.2 seconds, as you can see here. Next. And what is the duration of P wave? The duration of P wave is 0.12 seconds. Okay. Right. 0.12 seconds. Right. Next. Coming to QRS complex. What is the duration of QRS complex? As you can see here, it is less than 0.12 seconds. Okay. Less than 0.12 seconds. Right. Next. And what does the ST segment represent on the ECG paper? So ST segment, it is the segment between QRS complex and a T wave, and again it is a straight line, right? And it represents the time lapse between the depolarization and repolarization of the ventricles. Okay, as you can see here, this is the ventricular depolarization and this is the ventricular repolarization, and in between there is no electrical activity, and it is represented on the graphical paper as ST segment, right? Okay, right. And what is the QT interval? QT interval is nothing but it is from the beginning of Q wave to the end of the T wave, right? From here till here. It is a QT interval and its duration is less than 0.44 seconds. Okay, right. Next, this is same, different waves and segments and intervals. Okay, coming to P wave. P wave is 0.12 seconds, PR segment is less than 0.12 seconds, PR interval is 0.12 to 0.2 seconds, and QRS complex is less than 0.1 second, QT interval is less than 0.44 seconds, right? Okay, this much is enough. Next, so here it shows again P wave, PR segment, QRS complex, ST segment and QT interval, right? Okay. Next, coming to different ECG leads. Okay, what are the different ECG leads? There are 12 leads to record a ECG. Okay, there are 12 leads. There are 3 bipolar leads, 3 unipolar augmented leads, and 6 unipolar chest leads or precordial leads. What does the leads do? These are the electrodes which record the electrical activity of the heart. As we have discussed, these are the electrodes. So let us see one by one. Coming to the ECG leads once again. So leads are the electrodes which measure the differences in electrical potential between either 2 points of the body, which are known as bipolar leads, and between 1 point of the body and 0 electrical potential, which virtual reference, that is the center of the heart. Okay, these are the unipolar leads, right? Next, coming to anatomic groups, I'll come to this slide again. Till then, this is the bipolar lead. Okay, let's see the bipolar lead, and there are 3 bipolar leads, as you can see here, that is 1, 2 and 3. So lead 1 shows you it is there are two electrodes. This electrode record the electrical potential difference between the 2 points, that is between right arm and the left arm. So the electrode is placed as negative symbol to the right arm, and that is from right arm to the left arm. Okay. Next, coming to lead 2, which is very important. It is it records the potential difference between the right arm and the left leg. Next, lead 3 between the left arm and the left leg. Okay, so these are the bipolar leads. I will explain in detail. Till then, these are the three leads, and it is important to remember which leads are records the potential difference between which limbs. Lead 1 is from right atrium, right arm to the left arm. Lead 2 records the potential difference between the right arm to the left leg and left arm to the left leg is lead 3. Right. Next, coming to the unipolar chest leads. Unipolar chest leads are 6 in number, as you can see here. Lead 1, 2, 3, 4, 5, 6. So what are the positions? So we will represent them as V1 to V6. These are the precordial leads. V1 is placed along the sternal line. That is the right side. This is the right side of the chest. This is the left side of the chest, right? So the right sternal line at this place in the fourth intercostal space. This is the fourth intercostal space. We place the lead 1 V1. Okay. Next, coming to the lead 2 V2, we will place along the fourth intercostal space again at the sternal line, and coming to V4 is in the this is mid clavicular line V4, and between V2 and V4 we place the V3. Okay. Next, V6 is in the mid axillary line, so it is the mid axillary line, and V5 is between V4 and V6. Okay, these are the placements of different precordial leads, chest leads. Okay. Next, coming to augmented limb leads. So what do you mean by augmented limb leads? These also are unipolar leads which record the potential difference between this center point of the heart, which is taken as the 0 reference point, and to the right arm is AVR, to the left arm is the AVL, and to the left leg as AVF. So F is for foot, L is for left arm, R is for right arm. Okay. So next, so this is the only introduction to the different leads. Okay, there are totally 12 leads in the ECG. There are 3 bipolar, 3 unipolar augmented, and 6 unipolar chest leads. Okay, now what are the functions of these leads? So let me explain. Let me explain. So coming to heart, if you take this as a, explain in detail. If you take this as a man, so the heart is situated slightly towards the left side of the chest, and it's the axis will be something like this. So this is the base, this is the apex of the heart. Okay. So if you see, this is the lead 1. Okay, this is the lead 2, and this is the lead 3. So if you observe carefully, that lead 2 is along the cardiac axis from base to the apex. Okay, so lead 2 is very important on the ECG paper. It is regarded as a reference lead. Okay, and so let me explain clearly. This is the SC node. So the impulses from the SC node comes to the AV node and to the bundle of his bundle branch and to the Purkinje fibers, right? So this is the conducting system, and along the same axis there is which lead? This is the lead 2. So on the lead 2 there are waves. So this is the P wave, this is the QRS wave, and this is the T wave. So P wave is a positive deflection due to the atrial depolarization. So let's see this. So from the when the impulses from the SC node gets conducted to the different parts of the atrium, this is recorded as a slightly positive wave on the lead 1, which is along the same direction. Okay, next coming to lead 1, This is the lead 2. Okay. Next, coming to the lead 2, when a vector has this 45 degrees, it has both straight component as well as the horizontal component as well as vertical component, right? So when the impulses travel from SA node to the AV node, it has some horizontal component as well, right? So this is along the lead 1, right? So even in the lead 1 there is some positive deflection, but this positive deflection is smaller than the lead 2. Why? On the lead 2 there is bigger positive deflection because the depolarization is taking place along the lead 2 because it is the cardiac axis, right? So in this manner, let us see. So as I told you, this is the reference lead. So here you can see the typical P wave, QRS wave and the T wave. Okay. Next, coming to the QRS wave of the lead 1, it is slightly smaller than the lead 2, and the lead 3 is also smaller than the lead 2. Okay. Why does this difference occur? Because when the electrical impulses are spreading from SA node to the AV node, so this is the cardiac axis, from SA node to the AV node along the same axis, the P wave or QRS wave are represented very strongly. But when you take a part of it, that is a vector, when it is split into two parts, that is along the lead 1, it is slightly, the impulse is slightly smaller. Okay, right. Next, so when we combine all these, let me show you. So this is the lead 1, this is lead 2, this is lead 3. Okay, this is the bipolar leads. Okay. Next, coming to unipolar leads, they are AVR from the center point of the heart, AVL and AVF. So these are the unipolar leads. So when we combine both, this is AVF, this is AVL and this is AVR, right? So when we combine both these unipolar and bipolar leads, this is lead 1, this is lead 2, these are the bipolar leads, this is the lead 3, right? So let me show on a figure. So this shows the combination, both these things. So when you see the inferior part of the heart, it is represented by lead 2, lead 3 and AVF. Why? AVF is along the downward direction, lead 2 is along the cardiac axis, and lead 3 is also along the from right arm to the left arm to the left foot, right? Okay, right. Next, coming to the ECG paper, normal ECG paper, here you can see, right? So this is the lead 2, which is the reference one. You can see the QRS complexes are very strong, and in the lead 3 it is very small. Lead 1 is also smaller than lead 2. Next, so by this combination we can see that on the inferior side of the heart it is represented by lead 2, 3 and AVF. On the lateral side, anterior side and septal side we'll see once again. Okay, so let me show you. So when we are placing V1 to V6 like this, V1 to V6, V1, V2, V3, V4, V5 and V6. So heart is situated like this, right? Like this. This is the horizontal section, right? So this V1 to V4 represent the anterior wall of the heart, right? This represents the arterial wall of the heart, and V5 and V6 represents the lateral wall of the heart, right? Next, as we have already seen that, what is this? 2, 3 and AVF denotes the inferior wall of the heart, and lead 1 represents the anterior wall of the heart. And one more thing you need to observe is that this is lead 1, this is lead 2, this is lead 3, this is lead AVF, right? So there is one more lead, that is augmented lead, that is exactly opposite to lead 2. What is that? AVR. AVR. So what are the waves here which you are seeing on the lead 2 is exactly opposite to that of on the lead AVR. So let me show you. As you can see here, that on the lead 2 you are seeing these waves, and on the lead AVR you are seeing exactly opposite, because they are directed in the opposite direction on the body. Okay, next, coming to precordial leads or chest leads, they are placed as shown. I have already explained you that V1, V2, V3, V4, V5 and V6, and this is the, if this is the heart, horizontal section, and V1 to V4 represent the anterior wall of the heart, right? As you can see here, and V5, V6 represent the lateral wall of the heart, like this, right? So lateral wall of the heart is represented by V5 and V6. Next, this is the heart, this is the anterior wall, this is the lateral wall, and here it is V1 to V4, and the lateral wall is V5 and V6, right? Next, and along with this, you see this is the heart, this is the heart. Apex is represented by V4, right? And the septum is represented with V1 and V2. Please remember this, right? Next, if we want to see representation of the different leads on heart, this is the lead 1, lead 2 and lead 3. 2, 3 AVF are inferior, right? 2, 3 and AVF are inferior, yes. V1, V2 is septal, yes. And V1, V2, V3, V4 are anterior, as you can see here. V5, V6 are lateral side of the heart. AVL and 1 are lateral side of the heart. Okay. So once again, let me summarize. So if this is the heart, is the base of the heart, apex of the heart. Okay, heart, it has anterior wall, is the anterior wall, is the lateral wall, is the base, is the apex, right? Okay. If you see lead 1, 2, 3 AVF, AVR, AVR is the lead 1. Okay. If you see here, it is AVL. So AVL and lead 1 represent the lateral side of the heart. Okay. If you take this as heart, lateral wall is represented by AVL and lead 1. Inferior wall of the heart is represented by 2-3 AVF, and anterior wall, as I already showed you, anterior wall is represented from V1 to V4, lateral wall is V5, V6, right? Okay. So this slide is just showing these things, right? So exactly here it is written the same thing. 1 and AVL are lateral. Okay. Next. This is again the same diagram showing lead 1 and AVL or the lateral side, 2-3 AVL or the inferior. Okay. Okay friends, thank you. Please share, like, comment and subscribe.